You are welcome to the Lord TV, your number one fantastic reality TV that gives you all that it takes to be enlightened on trending news such as politics, entertainment, sports, and what have you. If you are new on this channel, kindly click on the subscribe button as well as already subscribed. So please don't forget to drop your comments anytime I drop new videos. Thank you. Ciao, ciao. Breaking news. First case of coronavirus disease confirmed in Nigeria. But before I proceed, don't forget to click on the red subscribe buttons as well as bell buttons to get updated anytime we upload new videos. Thank you. The Federal Ministry of Health has confirmed a coronavirus disease, COVID-19, case in Lagos State, Nigeria. The case, which was confirmed on the 27th of February 2020, is the first case to be reported in Nigeria since the beginning of the outbreak in China in January 2020. The case is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. It was confirmed by the Virology Laboratory of the Lagos University Teaching Hospital, part of the laboratory network of the Nigerian Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The multi-sectorial coronavirus preparedness group led by the Nigerian Center for Disease Control (NCDC) has immediately activated its National Emergency Operations Center and will work closely with Lagos State health authorities to respond to this case and implement firm control measures. I wish to ensure all Nigerians that we have been beefing up our preparedness capabilities since the first confirmation of cases in China, and we will use all the resources made available by the government to respond to this case. We have already started working to identify all the contacts of the patient since he entered Nigeria. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in others, particularly the elderly and persons with other underlying chronic illness. All Nigerians should take care of their health and maintain hand and respiratory hygiene to protect themselves and others, including their own families, following the precaution below. Regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Maintain at least 1.5 meters, 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay home or keep a social distance but not mix in crowd. Make sure you and people around you follow good respiratory hygiene, meaning cover your mouth and nose with a tissue or into your sleeve at the bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing. Please call NCDC toll-free number, which is available day and night for guidance, 0800 97 0000-10. Do not engage in self-medication. Stay informed on the latest developments about COVID-19 through official channels on TV and radio, including the Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformations that causes fear and panic. The Federal Ministry of Health, through Nigerian Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria. Thank you for listening to this news. Viewers, you can see that this disease has now been confirmed in Nigeria, but it wasn't actually contacted here. It was contacted over there, and the person eventually traveled down to Nigeria. But then the Nigerian hospital are doing everything possible to see that it doesn't spread away from the very room the person is kept. But my own candid advice is the doctors handling the patients themselves should be very careful. They should apply every skill possible to see that they themselves are not infected, because the transmission can still start from there. And also, the person should not be allowed to go away from where he or she is being kept, to prevent any unnecessary infection. And as we Nigerians, it's also an advice to us to keep to the instructions given to us by the Ministry of Health. We should not be adamant to instructions, because it's only stubbornness that can lead us to problems. And if we don't want to be infected, let's keep to information, because information, they say, is wealth. Okay, so as we do our best to see that this person is being treated, we'll try our best to stay away from anything that will cause infections to us. And also, I will advise that this news should be passed to our colleagues. Let's advise them to subscribe to channels. It's not a must that you subscribe to my channel, but just get informed by getting yourself subscribed to any online channel. If you feel that you cannot subscribe to my channel, good and fine. But it's very good you subscribe to an online channel, so you can always be updated on things like this. Okay, so you always be informed and not deformed. Okay, so don't forget to leave your comment behind. Click on the subscription buttons as well as bell buttons to get updated. Thank you.